Giving a birth is definitely a blessing experience, but women cannot escape from the pain associated with the pregnancy. Women experiences second birth when they deliver a child. Giving birth can be a joyful experience, but goes through tremendous changes both physically and mentally, just as being born again. This is why postpartum mothers are considered as a patient in Oriental medicine. We'll examine postpartum management in this session. Woman's body goes under tremendous changes after the delivery. Enlarged uterus constricts back to the normal state, and the hormonal release is altered, and the pelvic girdle repositions back to the original state. To make an analogy, this is similar to putting back the dismantled puzzle. During this process, female experiences pain around the abdomen, waist, or even the whole body.
산후조리라고 하는 것은
Postpartum management includes reinstating physical changes, such as enlarged uterus, lochial secretion, weight gain, hormonal changes, and even the family structure back to the state before pregnancy.
구성원이 한 명 증가하는 것에 대한 그런 상태가
Most of these changes will normally return back to the previous state, but caution should be paid to prevent any chance of postpartum sequela before it occurs.
이 기간에는 출산 후
The period in which the nursing mother has to pay extra attention is collectively known as postpartum care.
기간을 다 포함하고 있습니다.
Before the body returns to the normal condition. Oriental medicine considers this time block to be a crucial time to determine the future health. Postpartum stage is when the nursing mother is under extreme fatigue and very fragile. Even the slightest stimulation can cause problems and trigger an illness. Thus, Oriental medicine has developed a special program to manage the postpartum woman. This is known as the postpartum management. Postpartum care is naturally done in Oriental medicine, but in the West, mothers immediately engage in physical activities, takes cold shower, and goes back to work immediately. This is vastly different from the Eastern concept. Let's examine the postpartum health management recommended in Oriental medicine. Taking an ample rest is crucial during the first week. During the second week, try to maintain pleasant room and body temperature. Start light household works from the third week, such as changing the diapers. Start taking care of the baby at full strength from the fourth week and engage in light outdoor activities. Herbal medicine is necessary for the health management after delivering a child. For those with lack of energy or slow recovery, modified Sanghwatang is prescribed. This formula is comprised of 32 grams of Angelica sinensis, 16 grams of Cnidium root, and 2 grams of safflower seeds, and should be administered right after the delivery. This formula helps the constriction of the uterus to help discharge of the lochial fluid and break the blood clots. There is also a method of postpartum care by using the wavelength of electrical current combined with an aromatherapy. It's known as the electrohydrotherapy. This is done by taking a bath in water above 40 degrees, charged with an electrical current for about 12 minutes. An essence oil extracted from the plant is added to prevent viral infection.
저는 평소에 왼쪽 다리 부분이 좀 저리고 많이 시렸는데요. 이 수치료 받고 나서 몸도 가벼워진 느낌이고 다리 저린 것도 좀 시원하고 마음까지 편해지는 느낌을 받았거든요.
손가락 넣으시고 쪽으로 머리 하시고요. 쪽으로 엎드리시면 돼요.
Another method using a water is known as the aqua therapy. This therapy is based on the idea of using the constant pressure of the water. Just like the electrohydrotherapy, this method relaxes muscle spasm caused by the delivery and relieves fatigue accumulated in the whole body. Few nursing mothers complain pain in the lower back in extremities which is caused by poor blood circulation. Aquatherapy is quite effective for promoting the blood circulation and relieving pain. Along with these precautions, Oriental medicine recommends a postpartum exercise. This exercise is designed to start immediately after delivering a child. Postpartum exercise begins with controlling of breath. During the first 2 days, lay down comfortably and breathe from the abdomen. Change the positions into a few different directions and take a deep breath. Start from the 3rd day, bend and flex the extremities. Exercise in conjunction with breathing, such as contracting the abdomen while exhaling, and flex the knee and feet. From the 5th day, along with bending and flexing the extremities, start the exercise to strengthen the abdomen and waist. After 1 week from the delivery, besides engaging in these exercises, start motions to extend the body, but these motions should be gentle on the body. Bend and flex the knee during exhale until one feels relieved. From the 2nd week, start building the strength of your body. Bend one knee towards the body and raise the upper body. After 1 month from the delivery date, most types of activities are allowed. And remember to check the status of pelvis and waist from the clinic.
산후체조라고 하는 것은 임신과
Postpartum exercise is effective for constricting the muscles of the pelvis and abdomen that are expanded during the pregnancy. This exercise also promotes metabolism and blood circulation to prevent thrombosis and deformation of the pelvis.
효과가 있습니다.
The key behind the postpartum exercise is consistency, so it must be done every day for a few months after delivering a child.
좋습니다.
Postpartum care is not done by simply taking a rest. There are a set of rules to follow and avoid. Many suffer from depression from the worries of raising a child and losing charming qualities. So postpartum care should include psychological treatment as well. If you have been neglecting about postpartum care, it's time to pay more attention. Remember, healthy humankind depends on healthy women. Thank you, and tune in again next time.